Hi, Dr. Michael DiMattina, Medical Director of Dominion Fertility in Arlington, Virginia, just outside of Washington, D.C. Today I'd like to speak with you about the many advantages of a technique called PGS, Preimplantation Genetic Screening, in layman's terms, embryo biopsy. Dominion Fertility has been performing this technique for many years, and we've had great success with this. Now, most of our embryos are tested using this technique. We transfer a single embryo and expect pregnancy rates to be at least 65% per embryo transfer. Thus, most of our patients who undergo stimulated IVF with us are pregnant after only one or two embryo transfers of a single embryo after the embryo has been tested and proven to be genetically normal. The advantages with PGS are many. First, much higher pregnancy rates. We cannot get pregnancy rates such as those I've described unless we use this technique. The technique allows us to transfer a single embryo, so the twin rate is only 1% at most. Dominion Fertility prides itself in having, for the past several years, the lowest or one of the lowest multiple pregnancy rates in the United States year after year. The national average runs around 20%, we run 1%. And that's because we transfer one embryo, and now one embryo that is tested using PGS to prove the embryo is genetically normal. So higher pregnancy rates. Another advantage with PGS is not only the implantation rate is higher, but also the miscarriage rate is greatly reduced because we have tested the embryo and we know it's genetically normal the vast majority of the time. So we have higher pregnancy rates, fewer miscarriages, and more deliveries. It's just what's not to like. As you know, earlier this year I took care of a patient from Saudi Arabia who was 41 years of age when I saw her in January. Between the ages of 38 and 40, she had undergone 13 stimulated IVFs in Saudi Arabia with none of the embryos tested by PGS and no pregnancy after 13 stimulation cycles. When she came here in January, I told her we would do it a little differently. We did a single IVF. We obtained 20 eggs, 8 embryos were biopsied, and only one of her embryos was genetically normal using PGS. That embryo was transferred and she became pregnant. We sent her back to Saudi Arabia and we're expecting her to deliver sometime in the next 8 to 10 weeks. We're really thrilled for her. PGS is state of the art. Dominion Fertility is one of the leaders in the United States performing this procedure. We highly recommend it. We see the advantages, and we think that it may be an advantage for you too. So, message today, PGS is a great technique, wonderful technique, offering a lot of advantages and a lot of hope for many patients who suffer from infertility. Dr. Michael DiMattina, Medical Director, Dominion Fertility in Arlington, Virginia. Thank you very much.